Hello there, it's Ryan Liberty, and in this video I'm going to answer the question, what is Disruptive Mood Dysregulation Disorder, also known as DMDD? Ugh. Ooh, Alright, now that my temper tantrum's over, let's talk about what Disruptive Mood Dysregulation Disorder is, also known as DMDD. I hope I can get through this video without screwing that up. DMDD, Disruptive Mood Dysregulation Disorder. So quickly, I just have a few things to say before we get to what it is and what it feels like. This is not diagnostic criteria for DMDD, and it should not be used as diagnostic criteria. This is just a quick little description to give you an idea of what's going on when you have Disruptive Mood Dysregulation Disorder. And also, if the label of Disruptive Mood Dysregulation Disorder bothers you in any way, then you don't have to use the label. If it doesn't help you to heal, then just let go of it. It's not going to make a difference whether you use the label or not. This is just to point you towards a description of what may be going on in your life or the life of a loved one or a child maybe that you know. So with that out of the way, let's get into what Disruptive Mood Dysregulation Disorder is. It's a diagnosis that should not be made before the age of 6 or after the age of 18 for the first time. So its onset must be before age 10. And what you typically see with DMDD is that there are verbal rages and or behavioral temper outbursts which recur, and they're grossly out of proportion to the situation. So like a temper tantrum. It's inconsistent with the developmental level of the child, and it occurs 3 or more times per week. The mood between outbursts, because it's characterized by outbursts, but the mood in between these outbursts is often irritated or angry for most of the day, nearly every day, and other people can observe it. So it's not just you as a fatigued parent who is seeing this. Other people will say to you, your kid's maybe a little angry, he's a little frustrated more often than a typical child would be. And all of this has to happen for at least 12 or more months with no more than a 3-month break in between the symptoms. And you'll see this in at least 2 of these settings, which is home, school, or with peers, and it's typically severe in at least 1 of those settings. It's never something that you'll have a manic episode or a hypomanic episode happening for more than a day with, so if that's something that's going on, it may point to something more like a bipolar disorder. But so if there's manic or hypomanic episodes for more than 1 day, it is not Disruptive Mood Dysregulation Disorder. It's not major depressive disorder, autism spectrum disorder, PTSD, separation anxiety disorder, or persistent depressive disorder, also known as dysthymia. And it cannot coexist with oppositional defiant disorder, intermittent explosive disorder, or bipolar disorder. And it is not something that's attributable to a substance or a medication. But of course, as always, there's good news, which is that there's a treatment, and you could do things like individual or family therapy, possibly medication involved. But of course, go to see a therapist or somebody who can help you to put together a treatment plan. Now, in the body of somebody or a child who's experiencing Disruptive Mood Dysregulation Disorder, they're probably going to have some anxiety symptoms. So there may be sweating, there may be rapid heartbeats, tingling in the toes and fingers, and I have a video on anxiety if you want to check out what the symptoms of anxiety are, so look for that. As far as what's going through the mind of somebody with Disruptive Mood Dysregulation Disorder, I wasn't able to really find a description of that, but I could imagine they may have thoughts like, I can't do this, or I hate this, just generally frustrated thoughts. Emotionally, they're going to be irritated, they're going to be angry, they're going to be sad, and they may have some low self-esteem as a result of going through all of this. And behaviorally, you're going to see those outbursts. They may have trouble in school, they may have trouble getting along with family and making friends, and they may get into fights. So this is a relatively new diagnosis, but it was meant to kind of capture the children who don't fit into bipolar disorder, but are still showing depressive symptoms that swing kind of in that direction, that don't have those manic symptoms. I hope that I've given you a nice, good, well-rounded picture of what it is. If you or somebody that you know is experiencing it, I'd love to hear from you, so please share your experience below, leave any questions or comments, and I appreciate you getting to learn about it with me today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay and you are loved. Thanks again for watching.